Welcome to another episode of the Science Guide ASAP Learning, where we simplify complex medical topics. Today, we're diving into the world of Cluster C personality disorders. Good morning, students. Today we'll delve into a fascinating area of psychiatric medicine, Cluster C personality disorders. Before we go into specifics, let's briefly revisit what constitutes a personality disorder. Personality disorders, broadly speaking, are enduring and maladaptive patterns of behavior, cognition, and inner experience, which are substantially divergent from the expectations of the individual's culture, and are manifested across multiple domains of life. There are three clusters of personality disorders: Cluster A, B, and C. Each of these clusters has distinctive features that distinguish them from each other. Today we'll be focusing on Cluster C. Cluster C personality disorders are characterized primarily by anxious and fearful behaviors. These disorders include avoidant personality disorder, dependent personality disorder, and obsessive-compulsive personality disorder, not to be confused with obsessive-compulsive disorder. Avoidant personality disorder is marked by a pervasive pattern of social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation. These individuals often avoid work activities that involve significant interpersonal contact for fear of criticism, disapproval, or rejection. Dependent personality disorder, on the other hand, is characterized by a pervasive and excessive need to be taken care of that leads to submissive and clinging behavior and fears of separation. Lastly, obsessive-compulsive personality disorder is identified by a preoccupation with orderliness, perfectionism, and control. It is worth noting that OCPD differs from OCD in that it does not involve the presence of obsessions and compulsions, but rather an overbearing focus on perfectionism and control. Treatment of Cluster C personality disorders usually involves psychotherapy. Cognitive behavioral therapy is particularly effective for many of these disorders, and sometimes medications can be helpful for managing specific symptoms or co-occurring conditions. Now let's put this into context with a case scenario. Imagine a 32-year-old man named John. John is highly successful in his job as an architect. However, his coworkers often describe him as overly meticulous and rigid. John frequently spends long hours at work perfecting his designs and gets frustrated when things don't go as planned. He likes to have complete control over his projects and finds it hard to delegate tasks to others because he feels no one else can do it correctly. He has been persistently preoccupied with lists, details, and rules, which often gets in the way of project completion. He is also markedly reluctant to spend money and tends to save it for potential future disasters. John's features suggest a diagnosis of obsessive-compulsive personality disorder. His life is impaired not by obsessions or compulsions, but by an overwhelming need for perfectionism and control that affects his interpersonal relationships and work efficiency. That wraps up our introduction to Cluster C personality disorders. Remember, understanding these disorders requires time, empathy, and extensive clinical experience. As future medical professionals, it's critical for us to recognize these patterns and help guide our patients towards effective treatments. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one.